Hi everyone, my name is Tao Sun. I'm an instructor of radiology working with Dr. Nathan McDonald at the Brigham Women's Hospital. Today, it's such an honor to be here presenting several recent results from our lab in using focused ultrasound for immunomodulation in treating GBM as well as Alzheimer's. We have a special focus on the myeloid compartment of the brain. So we will be limiting our discussion on blood and barrel opening pulses, where we use low intensity pulse ultrasound together with intravenously injected microbubbles. As the field grows, it's well accepted that focused ultrasound assisted the blood and barrel opening is an attractive tool for opening up the barrier and deliver drugs to the brain. So now we have a standing question in the field that beyond the drug delivery, what else can we do, or what else have we already achieved or changed the cellular profile? And indeed, in our previous work, this work will be soon published, and we found that focused ultrasound can actually enhance T-cell infiltration locally to GBM. This has been confirmed using a bilateral tumor model together with systematic chemotherapy background. And you might want to ask why that matters. This is largely due to GBM is notoriously cold, or as many immunologists would say, it's an immune desert among many other cancer types. And what's worse is the standard of care therapy, including steroids, injection, systematic chemotherapy, as well as radiation, will all create an even more immunosuppressive environment. So we speculate that focused ultrasound can has several favorable roles in immunomodulation. First, it can enhance the delivery of the treatment agent. And secondly, it could potentially help to release more tumor antigen for improved dendritic cell maturation. And thirdly, it could help to enhance the trafficking and activation of the immune effectors, which will also be the focus of this talk. So before we analyze the cellular profile, we first conducted a survival study where we found that focused ultrasound together with anti-PD-1 therapy can actually bring more treatment benefits to a murine model of GBM. And further, we found that in flow cytometry study, a T-cell infiltration can be targeted cardiacally and enhanced. And as shown here to the left, and then what's more surprising to us, as shown here to the right, and there are significantly more polarized tumor cells in macrophage towards M1 phenotype. This is a phenotype largely characterized as a inflammatory phenotype compared to the M2 phenotype, which is more protective phenotype, which could be negative for slowing down the tumor progression. And and beyond that, we wanted to visualize the self-trafficking in a spatial temporal way. And to do that, we put a cranial window on the top of the brain, and with the help of the labeled immune cells, we can actually found a significantly more enhanced immune cells after 1 day of focused ultrasound treatment. And here, the green dots are labeled splenocytes, which are immune cells collected from the spleen. And you might want to ask, what are they? So we did a follow-up study, and we found that indeed there are enhanced number of CD8 killer T cells, as well as dendritic cells into the tumor. And beyond that, we also analyze the myeloid cells. And typically the microglia as well as the tumor-associated macrophages. To our surprise, we found that focused ultrasound enhanced the antigen presentation behavior more on the macrophages rather than the microglia. And this brings attention to a well-accepted knowledge in the focused ultrasound field, where previously we found the focused ultrasound itself and can clear the A-beta plaques, possibly due to the activation of microglia. However, in our results, we found that compared to antibody alone versus antibody plus ultrasound, there are no further activation of microglia. And instead, we think focused ultrasound affects the peripheral infiltration of monocytes, and rather than the direct activation of the microglia. This is echoing our GBM results, where we found that there are more antigen presentation behaviors or activation on tumor-associated macrophages rather than microglia itself. And again, this is such a preliminary data where we're just scratching the surface of the field. And with that, I'm plugging in my personal advertisement, where I'll be moving from Nathan's lab to Northeastern as the assistant professor in the spring next year. So my new lab will be focusing on the bubble theranostics to deliver image and manipulate the brain cells. So if you are interested, if you're students and you have some friends who are interested, please feel free to contact me for multiple openings in our lab. And with that, I would like to acknowledge all my mentors, especially Nathan, Samir, and Rakesh Jain, and all the team members. Thank you.